time thought that the plague was a result from the punishments of God or divine retribution for the sins of the people. And so a practice began where some people would strip to the waist and go from town to town several times a day, whipping themselves in order to maybe satisfy that punishment. And they were called flagellants because they were flagellating or whipping themselves. It also caused some unrest between people that had differences, whether they were different races or minorities. Suspicion went around and rumors went about some people not being affected as much or perhaps poisoning wells of the other, so they must have been the cause. And so some people would actually put to death other folks in their neighborhoods or communities because they thought they were to blame. The plague doctors at the time wore a very specific outfit in order to treat their patients, and it usually included a wide-brimmed black leather hat and a mask with a long beak with glass eye holes that was quite stark and maybe frightening to some people, but it was for a very specific purpose. The hat indicated their profession as a doctor. The mask, the reason they had the long beak was to put in strong-smelling spices or dried flowers that would make it so they didn't have to endure unpleasant smells, or they also thought maybe that could take the disease out of the air, so to speak, and it would help protect them from getting sick while they treated others. Now, during this time, people were desperate for some kind of a treatment or cure because most people were dying who got the disease. And so doctors and people were coming up with all sorts of remedies to treat the plague. And that included everything from bathing often in rosewater and vinegar to putting a live chicken near the sores on your body to draw out the infection, or ingesting everything from snakeskin to powdered eggshells, herbs, clay, anything they could think of to try to keep this disease away.
Plague symptoms are dependent on how the patient was exposed. Plague can take different clinical forms, but the most common are bubonic, pneumonic, and septicemic. Bubonic plague causes swollen lymph nodes. The swollen lymph nodes are due to the bacteria multiplying from the infected flea bite. Other symptoms include fever, headache, chills, and weakness. Pneumonic plague develops due to inhalation of infected plague droplets or due to untreated septicemic or bubonic plague. Symptoms are headache, fever, weakness, and rapidly developing pneumonia symptoms, including shortness of breath, chest pain, cough, and bloody or watery mucus. This is the most serious form of plague and the only one that can spread person to person. Septicemic plague can cause bleeding into the skin or other organs. This causes tissues to turn black and die, especially fingers and toes. Other symptoms include fever, chills, extreme weakness, abdomen pain, and shock.
A big part of emergency preparedness in public health is disease preparedness. And with plague, there are three types: bubonic, which is a disease that is carried by fleas and animals; septicemic, which is where the plague gets into the bloodstream; and pneumonic, which is also spread by humans or animals through coughs and droplets. At the health department, we have epidemiologists that if there ever were a case, and there have been cases of plague here in Utah, it is endemic through prairie dogs and other animals here in southern Utah. Our epidemiologists would work with the healthcare providers to identify the source of the infection and help provide recommendations for treatment. Pneumonic plague is of particular concern. It is extremely contagious, deadly, and it moves very rapidly. Someone who gets pneumonic plague without treatment invariably dies within just a few days. So with treatment, we have access to what is called the Strategic National Stockpile. If there ever was an outbreak of pneumonic plague, which can occur naturally or through bioterrorism, it could be spread by individuals wanting to cause panic and cause harm to our nation. So the Strategic National Stockpile could be deployed, in which antibiotics, which is the treatment for plague, would be rapidly deployed throughout the entire region. Southwest Utah Public Health Department has agreements with many organizations here within the 5-county area where we would deliver products or medical countermeasures from the Strategic National Stockpile that they then could distribute to their families, their friends, and treat them and prevent them from catching pneumonic plague.